Well, it is no secret that women giving birth in Mississippi have a very high vulnerability to poor outcomes, including death of the mother herself. That's known as maternal mortality. And nowhere else in the nation is it more dangerous to give birth, particularly for black women, than here in Mississippi. The state health department says at last report, black, non-Hispanic women had a maternal mortality rate 4 times higher than whites. The number one factor related to the chances of a woman dying giving birth or within a year of having a baby is her physical health. It's what Getty Israel has spent years in the healthcare community here trying to change.
I think the main problem associated with this is, or risk factor associated with this is obesity. Many women are unhealthy before they become pregnant. They're unhealthy because they have too much weight on their bodies. We know how obesity affects the general population. It's associated with diabetes. We have high rates of heart disease. We have high rates of hypertensive disorders. Now, take a percentage of those women, a percentage of women from that general population and make them pregnant. And they're overweight and they're already predisposed to experiencing these chronic conditions.
So what can Mississippi do to change this? Israel says it starts with the primary caregiver.
And what we know is most women who become Medicaid eligible when they become pregnant haven't even had any primary care. And what does primary care really look like? They may or may not put you on drugs at that time, but do they engage you around behavior health modification? In other words, do they talk to you about your diet and your lifestyle? Tobacco, alcohol, obesity, eating bad foods. So is that what we really want to do in Mississippi? Put more people on drug medication for diseases we couldn't prevent? Those are the same diseases wreaking havoc on the pregnant population. Preeclampsia, hypertensive disorders, diabetes, heart disease. These are conditions that we can alleviate, at least most of them, if we start working to get women healthy before they become pregnant.
Israel and her nonprofit, Sisters in Birth, have been doing this kind of community health care since 2015. Chanel Portia Albert is the founder and executive director of Ancient Song. It's a national birth justice organization working to eliminate maternal and morbidity among Black and Latinx people.
I think we have to look at the ways in which providers are educated. It's centering a framework of cultural humility in the ways in which we are meeting patients where they are, not where we expect them to be.
Being on the front line, advocating for pregnant women in Mississippi, Getty Israel believes it is not just the responsibility of the healthcare giver, but rather a real partnership.
Doctors can't fix you. It's your job to fix you. Doctors and midwives are supposed to work as partners with patients, but too often patients expect that the responsibility should all be placed on the healthcare system. And as much difficulties as the healthcare system may have and challenges, the healthcare system ultimately is not responsible for your health. You are.
Getty Israel's nonprofit organization, Sisters in Birth, helps pregnant women with a variety of services. She and her staff will be with you from the beginning to the birth of your child and afterwards. And it is free. Go to sibirth.org and complete the intake form.